Hi, my name is Lawrence Contreras. I'm a physical therapist with CACC Physical Therapy here in Aurora, Colorado.
And my name is Robert Rodriguez. I'm also a physical therapist here at CACC.
Currently today what we're doing here is to do a shoulder protocol for post-op surgeries in the aquatic therapy program. We want to make sure that we're ensuring your safety and also proper technique and what phases you should be doing at your rehab. During this video, you'll see phases going from easy passive exercises all the way to strengthening more resistive exercises within the pool.
This is passive range of motion for the shoulder. So we're going to pretend that Lawrence here had his left shoulder done. So this is the shoulder you want to work on. This is meant to increase your range of motion and allow that buoyancy of the water to help out. So all you're going to be doing is gripping with that hand, and what you can do is take your non-involved hand, your right hand, and all your force is going to be with that right hand, pushing that noodle down. So all Lawrence is doing is using that right hand to help his left arm go through that motion. So you're going to do flexion, which is straight out in front of you. You can do scaption, which is a little bit of a diagonal. And then remember, we're limiting abduction, so we're not going out into this motion just yet. And everything for now should be limited to 90 degrees, so shoulder height. Alright, so now we're going to work on external and internal rotation. So we're going to be doing external rotation, keeping your elbow at your side, rotating out towards the left, and then rotating in will be internal rotation. So remember, you want to limit this to about 20 degrees, so be nice and gentle with the motion, just about right here with both. And you can use this kickboard to help yourself get that range of motion. So what you're going to do, keeping the elbow at the side. Once again, this arm is completely relaxed, and Lawrence is utilizing his right arm here to assist the left arm into the motion. So you're going to be pushing with that right hand nice and light to get that external rotation, and then pulling with that right hand to get that internal rotation. So this is a different variation of how you can help with that external internal rotation. Remember, this is supposed to be passive once again. So Lawrence is keeping that shoulder relaxed. He's using his grip strength to hold the railing. All he's going to do is turn his body away to get that external rotation, and then towards to get the internal rotation in that shoulder. So the next set of exercises are going to be active assisted range of motion using the buoyancy of the water, and active range of motion also in the water to help the muscles get the motion. So what we're going to be working on is flexion. Lawrence is going to demonstrate these motions, and then we'll show you how you do it in the water using a snorkel. Flexion, straight up in front of you. Abduction, out to the side. External rotation. And then an internal rotation stretch behind your back. And typically at this phase, in 6 weeks, there are no range of motion limitations. However, you want to consult with your physical therapist and of course your surgeon to make sure there are no specific limitations on your range of motion. Okay, now we're going to demonstrate some exercises you will be using in that 8 to 12 week phase of your rehab. So now you're allowed to do a little more specific strengthening for your rotator cuffs. The objective is to buff the cuff. Okay, so we're going to work on shoulder abduction with the fins, and Lawrence can demonstrate using these yellow fins. Basically going to increase that surface area, cause a little more drag through the water, so you're going to get a little more resistance. So he's doing abduction and adduction, bring it in towards the body. Next one you can do is an internal and external rotation. You can also work on flexion of the shoulders. Making sure every time you go through that motion, those yellow fins are going through the resistance of the water. Last one Lawrence is going to demonstrate is resisted shoulder flexion while you're walking. So he's going to hold the fins out like this and then walk through the resistance of the water, getting a push through his shoulders. Now Lawrence is going to demonstrate kickboard pushing and pulling. So it's a great exercise for your triceps and your chest muscles in front as you push, and as you pull back, you're working some of your shoulder blade, those scapular stabilizers. So he's going to push and pull against the resistance of the water. And always remember, the faster you go through the water, the more resistance and the more difficult this exercise will be. So now we're going to demonstrate a few more advanced strengthening exercises that are also going to utilize that buoyancy of the water to provide a little more stabilization from that shoulder joint and your scapular muscles in the back. He now has his toes on the ground of the pool. His forearms are rested against that kickboard, and what he's going to do is pull that into his chest and then push it out. The farther you go away from your body, the harder it is. So now once again, you're working on these shoulder stabilizers, and you're also doing a little bit of core muscle exercise as well. Next exercise Lawrence is going to demonstrate here is a crunch. So he's keeping his arms at the sides, elbows locked out, full extension, and he's keeping his shoulder blade muscles very tight and retracted, pushing them together, keeping himself suspended in the air as he's bringing his knees up into his chest. The next exercise Lawrence will be demonstrating is called the tick-tock. So what he's doing, he's going to bring it underwater with the dumbbell, always progressing to a larger dumbbell eventually. And he's going to move his arm back and forth like this. So that water is trying to push his shoulder up, and he's using those muscles of the shoulder blade and his rotator cuff to keep it suspended in the water. Now we're going to demonstrate some more kind of aggressive stretching techniques here. You can typically start this once you have no range of motion restrictions, around 6 weeks. But obviously, once again, you want to consult with your physical therapist and your surgeon to make sure that's okay to do. The first exercise we're going to demonstrate is called the gorilla hang. So Lawrence is going to put his arms and grip on that handrail. You can also do this one at a time if you want. And he's going to let himself lower into the water using the snorkel. And you're going to get a more aggressive stretch on that shoulder. Next, we're going to get a little bit of a stretch stretch on the biceps muscle right here in front. So it's important to keep that thumb pointed down, and you're going to extend the shoulder backwards with the elbow maintaining that straight position. What Lawrence is going to do is grab onto the side of the pool and then bring his body a little bit forward. So he's getting a stretch through this biceps muscle here. Once again, his thumb is turned down, his shoulder is behind him, and his elbow is straight. Now Lawrence is going to work on stretching out his pectoralis muscles here. So it's similar to a stretch you can do outside the pool called a doorway stretch. But what you're going to do is find a corner and then get in this position, bringing the arms out to the side, and then he's going to lean into that stretch. If you're doing this correctly, you should feel it right there in the chest area. Now Lawrence is going to demonstrate what's called horizontal abduction and adduction. So, once again, shoulder height with those hands. You want those fins to go against the resistance of the water. Lawrence is going to open up the chest going out this way. And then he's going to pull back in this way. Now Lawrence is going to demonstrate what's called shoulder depression. So what he's doing, you want to turn around this way, Lawrence. He's going to push down these dumbbells into the water, working on trying to depress and bring those shoulder blades down into your back pockets. So he's squeezing those shoulder blades together and pushing them straight down against the resistance of the water. Lawrence is now going to demonstrate a wall push-up. It's exactly how it sounds. You're against the railing here, against the side of the pool, going into that push-up position, and then back up. Working on strengthening the chest. Another good exercise you can do is on the railing is a pull-up using that railing for support. So Lawrence is going to grip that railing. You either have your legs hanging or you can have them against the wall, and you're pulling yourself up, strengthening your upper back muscles. Another exercise you can use with the railing, this would be in that passive range of motion phase, is a self-stretch. So what Lawrence is going to do is grip that railing, and then he's going to lean his body away from the shoulder, bringing the head down. It's important to note though that you want to do this once you have no range of motion restrictions, because as you can see here as Lawrence is moving away, he's going above that 90-degree point. One more exercise Lawrence will demonstrate for you today is called a pulse. So what he's going to do is keep those dumbbells about halfway in the water, and he's pulsing them up and down, keeping his elbows straight, primarily moving from the shoulder blades here. And what we like to do is have people do this here for about 30 seconds, move into that scaption plane for about 30 seconds, that diagonal plane. And now he's going to move into the abduction plane. This is the lift-off exercise, once again in that advanced strengthening phase of your protocol. So Lawrence is going to rest his arms here against the side of the pool, and he's going to use those shoulder blade pressors and lift himself into a sitting position on the edge of the pool.